Well, thanks everybody for having me here this morning. Happy Valentine's Day. It's a great way to start the presentation. One of the things that I'm going to chat about today is sort of the disruption that's taking place in the medtech industry, but I really think of it as a period of dislocation. And I differentiate disruption from dislocation because disruption, think of it like a speed bump. We have disruptions all the time in industries and certainly in medtech, but I believe we're in a period of severe dislocation. And that dislocation is a breakaway moment in how we sell, in how we develop devices, in how we interact with partners. So all three of those today will be my focal point to share with Freudenberg because of the unique position that you're in the industry, being a key, powerful supplier and partner in medtech. And this past week was obviously the MDM show, and as I walked the floor, and we have a very large practice in this space, I had been solicited by a number of people, why is this occurring now? Why is this such a great age for medtech? And some of it has to do with the large strategics are no longer going to be bothering trying to do what Freudenberg and suppliers do so well in the industry because of the acceleration of that technology. So we'll chat about that today. I want this to be interactive. I want hands to go up, please. I promised Max that. I want hands to go up. I want challenges. I want questions. I want clarifications. Because some of the things I'm going to be saying will be dislocating thoughts from the way that all of us, I've been in the industry for 30 years, have sort of focused and realized what the industry was. Where it's going right now is never been navigated before. And so it provides a tremendous opportunity. So I will ask you to interact with me, and again, questions, because we're going to talk about what you do and how you're selling. And I'm going to challenge you and question you and make you incredibly uncomfortable with how you're doing things right now, which then offers a great opportunity to think about things moving forward. As Max had shared, 30 years in the medtech industry search. We are by far the most successful search firm ever. More than 7,000 placements. A majority of those are in emerging tech companies. And I share that with you because that gives me access to the CEOs, the venture capital, the private equity, and the people who do extraordinarily well, and the people who crash and burn, and what they did not so well, or mistimed, or had a previous opinion on something. So I oftentimes think of myself as a psychiatrist, and laying on my couch are the wins and the losses in the industry, and I learn a lot from that. So I bring a very unique perspective in that area. And because it is emerging tech, it's typically what's going to happen moving forward. I'm going to stand as much on this side as possible so I don't go blind. When you look at any technology in any space, you have the innovation S-curve we should all be familiar with. And this innovation S-curve is the birth of a technology or a process, and then we start to move up into the growth period. This is where you have the very early adopters on any technology, process, or product. And then you start to have the maturing of the product, and then you have the saturation. And that takes place with any product, any platform, any process at all. It's very, very standard in any business environment. Here's where we are right now in medtech. First, I'm going to touch on where the industry is going very quickly right now, and not many people are there. We're looking at predictive analytics, digital surgery, last mile technologies, teletherapies, and then the convergence of biotech, medtech, and pharma. And we'll break down these one by one. As I go through these, also keep in mind that we are in a period of time and a rate of acceleration that we have never experienced before. We've gone through many, many eras, agricultural, industrial, but now we are in a tech era where the acceleration of technology is so rapid that we cannot even keep up. because we've moved into a digital age. And when you think about mechanical, which is where we've all lived our life, injection molding, extrusion, secondaries, et cetera, those have been mechanical products that are very challenging to scale, and they're all in a one-to-one basis. But when you start to move into a digital environment, you start to move into a rate of acceleration that is logarithmic. And we all know Moore's law as well. Capabilities go up, costs go down. So we are sitting here right now. Our ability to adapt and the industry's ability to adapt is there. And in the middle is where the opportunity is for the organizations that believe in this rate of acceleration and start to plan their businesses and their processes to take advantage of that arbitrage, that gap. So where's the medical device market going? Let's talk about predictive analytics. And I want you to look at this from a broad product category, and then I want you to think about where your current portfolio fits into this category, and then where don't you fit and where should you be thinking about fitting. We chatted last evening. We had an interesting conversation last night at the dinner, which was fabulous. And we had talked about the contract manufacturing world. And in the contract manufacturing world, historically, what does the contract manufacturing world mean to the people around the table? Let's just throw out single words, phrases, sentences. What is it? What do you make historically? What does Freudenberg make? What's the product portfolio that we make in MedTech? Please. Tubing, jump in. Injection molding. What else? Finished devices. What else? Systems, assemblies. So, and why do we exist? Why do we provide a value? What is the value we provide to the industry? Why do they come to us instead of doing it themselves? Depth of technology. What else? Cost. Convenience. Time saving. Core focus of you, and they can focus on their core focus.
Investments that they don't need to make because it's within the contract manufacturer.
Investments they don't need to make, and they can take that dry powder and put it towards something else in their portfolio that moves them forward. So with that, we're talking about mechanical products for the most part. Historically, Freudenberg's been built on the mechanical products. So we've offered up a contract manufacturing footprint. We've got the equipment, we've got the process excellence, we have the people, we have the tribal knowledge. Now, as we go through these next few slides, we're moved into a digital age. So how does a contract manufacturer stay relevant in a digital age? Maybe it's sensors. Maybe it's a service that's provided to emerging tech startups. Like, should you be in the cloud business? Should you be providing cloud services as a contract manufacturer rather than extrusion, injection molding, and secondary machines? It's not instead of, it's and. Because if the entire market's moving there, how are you going to respond to that? And that's part of the challenge I'm going to give you today as we go through this, is think beyond what your conventional core competency is. Digital surgery, you've all heard about the robots. They're coming to kill us. They may save us in the meanwhile, but eventually they are going to terminate us, all of us. It's going to happen, but maybe not in our lifetime. Large format, small format, disposable robots, end effectors, and one of the largest emerging tech platforms in robotics is going to be a disposable robot. The large format robots will fall within 2 or 3 major players, and they will control that and throttle that just like Intuitive has today. Johnson & Johnson has moved up on that. Medtronic's moved up on that. The ability to support a full large platform robot is incredibly expensive to maintain, service, supply, and product development. So that limits the market. But if you move to the disposable robot, it starts to become very inclusive, and you can start having $200, $300, $400 million a year players in there. So my strong recommendation for Freudenberg is to look at the disposable robot market, get that on your radar screen earlier than later, and it revolves around catheters, guide wires, small mechanisms that are all disposable. After the use, they take that and they toss it out. And it is going to rival in the large format robots and going to cut into their use. and it's going to open up a brand new swim lane. So that should be on your radar screen. Last mile technology, smartphones empowering patient care, real-time diagnostics. We're all connected on the last mile, may I? We are holding a medical device in our hand 24/7, 365, an onboard computer. Many, many technologies right now in the consumer med tech market are being built around that technology. We see it in the diabetes market. We're going to see it in sleep apnea. We're going to see it in many. There's an onboard computer, predictive analytics on that last mile technology. Teletherapies. It's on the table now. Corindus, Siemens, the acquisition, Telestroke. You can now have a stroke in an entirely another country, not have a stroke therapy center there, call up a doc in New York, operate on somebody in Germany. All you need is a team there. Teletherapies are going to be very real because they improve access, create better outcomes, and are cost effective. Out of the gate, perhaps not, but give it time. They will be very cost effective. So I would be looking at teletherapies aggressively. And then finally, the convergence of markets. Are we doing any combination devices within the Freudenberg portfolio? What percentage of our portfolio is that? Roughly?
About 15%.
1.5? 1.5.
So we're coating drugs, drug-coated balloons, and other.
Drug-coated balloons, sensor-embedded technologies on products over the counter, biotech combination drug device, coming very rapidly. There's a large, I probably don't have to tell you, there's a very large contingent within the US that only focus on, in the manufacturing environment, drug device, combo devices in the supplier side, contract manufacturing. What they aren't doing a lot right now is believing in implanting sensors and the ability to create a connected device. Because once you create a connected device, you tremendously increase the value of that device. If you as a contract manufacturer can create a sensor, a connected device, and allow it to be connected, the value prop to the strategic, the OEM, jumps dramatically. If that value jumps dramatically to them, what does that mean to your value to the strategic? Respond or predict. Those who respond will be out of business. Those who predict will thrive. Last night we were having a conversation about disposable scopes. Love to hear that. It's my belief that in the next 5 years, the reusable scope business will pretty much be out of business because of the cost associated with running a scope. You have the cost of the scope, then you have 2x on top of that between reprocessing, sterilization, and services. You ask most surgeons, they really don't understand what it is to put a scope in their hand and what work goes into that. They just know it appears magically. But if you talk to the work teams behind them, there's an enormous cost in that of time that eventually is pushed over to. And then you're going to start moving into ambulatory surgery centers. Ambulatory surgery centers cannot have sterilization equipment if they can spare it. They're not going to carry inventory. They might not have enough procedures on a weekly basis to justify a striker stack or a stored stack and then reusable equipment. So that was just one example, is respond or predict. Predict where the market's going to be, and then start your acquisition strategy and start your process development, new product development in-house geared at those. Pause there. Any questions so far? So, digital connected devices, IoT, Bluetooth. Why do people use us? What do we provide? And is this who we are currently? Is this our value proposition to the market? Extrusion, injection molding, thin films, insert molding, and then what? What does the product roadmap look like? And have you thought about addressing that top data point as probably 50 to 60% of what you should be focusing on over the next 3 to 5 years? Capital investment is substantial. cultural mindset is substantial. You're going to hire different talent. I will tell you, your competitors are struggling with all of those decisions. To pull the trigger on the money spend, to pull the trigger on understanding how to hire software engineers, double E's, systems engineers, controls engineers, et cetera. Those typically may have not been Freudenberg hires in the past, but they should be moving forward in the future. This is probably the most powerful statement I think I could share with you today. In the device market, platforms are going to come and go because of the acceleration of technology right now in medtech. You have felt it over the last 3 to 4 years. Who's been in medtech longer than 20 years here? Keep your hands up. Keep your hands up. 30 years? 40 years? Right. So you have seen the acceleration just in the last 3 to 4 years of technology that we have never seen before. And that's not going to stop because it's digitally driven. We're in a really fortunate position here, Freudenberg, because we still touch the patient. Digital companies don't care about touching the patient. That's a high liability for them. It's not a core competency from them. They do not want to touch the patient. They will allow us to be the labor force that touches the patient, and what they want from us is the magical data so they can monetize that. So we do have beachfront property, but we can't sit on that beachfront property without becoming the glue between that digital connection via the mechanical touch point with the patient and reducing the friction there. That's why I threw out the idea earlier. Should we be in the cloud business? Why shouldn't we? Flex is doing it. Anybody here know who Bright Insights is? You ought to, because they're going to be a competitor of yours. So Flex, we know who Flex is? Flex started to create a cloud-based environment. I'm just giving you an example, something to think about. And they spun it off and created a standalone company called Bright Insight. That company is creating a cloud, so they're a contract manufacturer for connectivity. They've created a cloud that small startups can have their Bluetooth or IoT get up to there. Large to mid-sized companies, large surgical robotic companies who are terrible at creating a cloud environment. All of them. But I have cyber covered, I have FDA regs covered, I've got security covered, I've got upgrades covered, I've got SaaS covered, and I've got 50, 60, 70 people just working on that every day. That's what Bright Insights is doing. Because their customer base, they're startup companies who we want to get on the bill of materials, because once those startups get picked up by the large player, what happens? Volumes scale. And we're on the bill of materials. And that's really where our revenue is. But if we have a blind spot in an emerging digital world in where 1 out of 3 devices now is going to be connected over the next couple of years, and that startup company puts you on their bill of materials for a sensor and or a disposable, but then they can go somewhere else to get that cloud. If that ends up being Flex, that bundling capability is going to work against you if you're not offering some sort of partnership connectivity. I'm going way out there, and you've not heard this before, but this is why I want to have this conversation. You need to stretch that far. Why would you not be a contract manufacturer with a digital platform? Connecting all the devices and now having other opportunities to the organizations that are startups that need you. Let's just go back here. What we do and not what we make is I want you to have that etched in your head today. We should not be defined by what we make. We should be defined by what we do. Because what we make is going to change if we agree that tech and platforms are constantly going to be dislocating. And if you're entrenching yourself on what you make today, not on what we do, you're going to limit your upside tremendously. So let's use some examples. Most have seen these. We've all lived them. Historical misses on people who made the mistake of locking and loading on what they make versus what they do. Motorola, fixated on the phone business. Did anybody here have the flip phone way back when? The Motorola Razr, right? They thought they were in the phone business when really they were in the connectivity business. And now it's owned by Samsung and a few others. Kodak, everybody knows that train wreck. The interesting thing about Kodak is Kodak invented digital imaging. They held all the patents on digital imaging. But they thought they were in the film business. They were able to sustain till 2006 before they claimed bankruptcy on the patents and the royalties on the companies that were using digital imaging against them. And then finally, when the patents ran out, is when they ran out of money. How sublime is that? But they made the mistake that they were in the film business. The album business no longer exists other than sort of some outliers and some classic traditionalists who still like wax and vinyl. But they made the mistake that they were selling albums, not sharing songs. And then Blockbuster. They were in video rental and brick and mortar when really they were in the business of sharing movies. The list is pretty long, but you see where we're going with this? Is what business are we in? And then you can ask me, what are we going to make over the next 2 or 3 years? That should be the order of your questions every single time you're thinking about 12, 24, 36, 48 months. Creating value in the marketplace and then go for sales. From the conversations I've had with some of the leadership here, what I really like is it seems to be a very long-term horizon on decision-making, acquisitions, integration. And that's fantastic. There's not many that are practicing that. There are those that preach it, but practicing it is a different approach. What you want to do into the external market is you want to create value first. Don't jump into selling. Create tremendous value in a marketplace patiently, and then you want to execute on sales. Too many people jump in feet first on sales, and everybody sees that coming. But where's the value in the marketplace you're providing? Either in reducing friction, creating partnerships, ideating, collaborating. The sales will follow on that. So let's talk about how you sell in a current market and how I'm going to recommend a new point of view. Statement earlier, be defined on what you do, not on what you make. How many people here are in sales directly out on the front line? 1, 2, 3. And how many people here manage sales? Reports in. Max. So every year, fourth quarter, we get our sales team together and we say, how much money do you want to make next year? How much revenue do we need next year? And what's the first move we do? We start doing math. We start looking at what the product costs, what our margins are, how many sales calls did you make last year, how many doors did you knock on, how many hotel nights, how many miles did, we do math. We just extrapolate out math. And then we figure out how many of these calls, prospective calls, do we have to make in order to hit that number. We do the math. Number of sales calls. These are the activities then that we monitor. As a sales leader, you monitor math. And if we agree that rewards drive behavior, because we're rewarding that behavior on inspecting the math, that's what our good soldiers do. I'm curious if in your sales plan you reward behaviors like metrics on postings online, engagement with your postings online. How many followers did you pick up last month? Does anybody do that? Is that included in your strategy or in your math? Don't feel bad. It's in very few people's. Let me introduce you to my little friend, LinkedIn. I'm sharing this first because I've lived it and I've had clients live it. When we started to use a marketing strategy that really sales are only an outcome of an effective marketing strategy. They're evidence. When we started using LinkedIn as a marketing strategy, it is not a job board, it is not a Rolodex, it is not a resume house. It is by far the most powerful tool that business has ever seen in a B2B environment in the history of man, and it's free. There are 660 million users on it. There's 2.1 million medical device users on it. This is medical device. This is not doctors, physicians, healthcare, nurses. These are people in the medical device industry. On average, the medical device executive, and I bring up manager, director to VP, is on there minimum once a week, most of the time 4 days a week. That's your call point most of the time. I did a little detective work before I came, and other than a few of you, you really don't have a footprint on LinkedIn. And it's because these two cohorts ruined it for you. You associate social with duck lips pictures and kitty cat videos that your nieces put on there or your grandmother put on there. And therefore you disrespect the platform. Because you think LinkedIn is Facebook or Instagram or TikTok, and it's not. It just happens to be a platform on the internet. But these two ruined it for you. And I'm thankful for it because it makes it easy for me. Same tool, different ROI. You give LeBron a basketball, he's making $100 million a year. You give Billy Bob a basketball, he's not making much. I'm going to help you. If you're not a digital native, we're going to think about reputation instead of brand, and we're going to think internet instead of social. Here's my recommendation. Educate the market at scale. Be a media company that happens to be in contract manufacturing, and have patience and understand timelines. When we first do this consulting for clients, they say, am I going to see an ROI? Or what's the response? 30 days, 60 days, 90 days? Because on math, you can run people out and throw a bigger hammer at the market and sort of hallucinate and convince yourself that you're making a difference, because that's what we do. We increase muscle. We just throw more people at the problem. And that's a very expensive solution, but that was the solution up until the last few years we had. Bigger hammer. Your timelines on this are intended to create an inbound business. My sales people here, would you rather have an inbound call or an outbound call? And what's your closure rate on inbound versus outbound?
Inbound for sure, and I would say it's 2 to 3x probably.
2 to 3x. And an inbound call didn't require me to hop on a plane, bang on a door, beg at a VP of R&D, and wait in line while my competitor was in there calling on them as well. So you want to create an inbound mentality in your business. Super critical. Inbound closes much more effectively. Now let's talk about a marketing machine. Awareness and intention drives inbound all day long. Please understand that I do not want to replace your outbound teams. What I want to do is amplify their efforts. When you drive your business towards an inbound business, it changes the type of people you can hire, right? You still all, when you're interviewing a salesperson, go, I think she's a hunter. And then somebody says, oh, I think she's a gatherer, right? We still use that. And you have a very finite population out there that you're willing to hire. When you start to drive an inbound business, it changes the dynamic of the individuals you can hire, broadens the category, and makes that individual much more profitable and happier and fulfilled in their role in your organization. When you drive inbound business, it's a different animal. So what I'm sharing with you is I'm not saying toss out the sales effort. I'm not saying toss out the outbound initiatives. What I'm saying is let's learn to tell our stories online so it drives inbound and then makes my outbound activities a very warm call. I still categorize my business in A calls, B calls, and C calls. A calls, we all know what they are. Take my call, sit on the phone with me, converts high frequency. My B calls, they sort of know me, they sort of know my firm. C calls, never heard of me before. In the last 5 years, I've never had a C call or any of my 30 account executives because of our footprint and the marketing that we do in regards to what our organization does, not what we sell. We build companies and careers. We are not a search firm. And it's not semantics. We inform, educate, and infotain. If any of you follow me on LinkedIn and some of my senior people, you will never once see me say, use the Mullings Group, we've made 7,000 placements. Instead, what we do is we use our platform as one to inform and educate. We talked about this having a higher closing rate. So here's our traditional approach. I'm just going to beat this thing to death. One more slide. We drive to the customer. We wait. We cold call those ready not to buy. Got to show up anyway. Show me your numbers. Let's do the math. And then we try and displace a current account and get our spot on that bill of materials. That's what we do. It's not wrong, but we have to do more than that. And if we do that in harmony with an outbound initiative, we avoid doing this, just throwing more people at a problem. So you need two things to do to dominate. You've got to communicate to the market, and you've got to have a killer product or service. Those two things. If you get out communicated over time, you will lose, even if you have the best product. A good product with great marketing crushes a great product with below average marketing in the long term, every single time. Let me say that one more time. A great product with weak marketing gets crushed by a solid product with great marketing. The world looks like this right now, everywhere, not just online. And so what you've got to do is you've got to get that signal above that white noise. And it does not mean putting ads in MDDI magazine on the inside cover. It doesn't mean buying $1,000, $2,000, $3,000 ads on the inside of these magazines or periodicals. Yet that's still your go-to move. I get it. But that doesn't work anymore. You've got to figure out how to get a signal above that white noise. The customer is savvy today. The customer's being marketed to in the rest of their life. Instagram, Facebook, Twitter, LinkedIn. Let's just stop there because that's where the adults play. You're the same brain on all those platforms. But you stand guard at the way the information comes to you in a different way on each of those platforms. Those who have been on LinkedIn have seen the people get accosted when they put something inappropriate on LinkedIn, if it's not business related or if it seems racy or inappropriate. That LinkedIn crowd stands guard. So do you. But if on Facebook, who's got a Facebook account here? Great. So if you get, what do you go to Facebook for? Family business, alumni, what else? Why else do we go to Facebook? Who else had it? No Facebookers. We got to get you guys on the on-ramp into digital. Just the on-ramp. I'm not even going to get you on the highway. Twitter, probably the most powerful platform for business, in my opinion, the easiest to manage. No Twitter account. Twitter? Mainly for news, right. I call it bubblegum news, but it's really easy news. Twitter. Do you know the #1 platform that the medtech CEOs are on Twitter? And highest level of engagement? Highest level of engagement. Typically CEOs, the most active person on Medtronic, on LinkedIn right now, who's the highest placed exec in medical devices, Jeff. Jeff Marth's on there posting every single day. Everybody know who Jeff is? The new leader of Medtronic? It's on there every single day. More and more CEOs. Scott Hunnekens is on there every single day. These decision makers are on there every single day. Perhaps the 58-year-old white guy who was not a digital native is not on there every day. But I can guarantee you their 35 to 45-year-old digital native director of manufacturing, she's on there. That 28-year-old decision maker on who's going to use a balloon or a sensor or a device, he's on there. So just because you don't want to be on it doesn't mean that your customers are not on it. You don't have to agree with it. You just have to know it works. So if these decision makers are not aware of who you are, and everybody just in the back of the head says, everybody knows who Freudenberg is. So Freudenberg, do they know, are you sure that everybody knows what you do? Or just the people who pick up the inside of that magazine cover or walk by your booth this past week? And then in their mind, they know what you do. But it's not right. It's limited. It's smaller. It's never bigger. It's your job to tell that story in a place that people are showing up to watch. They're not showing up on the inside of a magazine. And how many people in the entire industry were walking the floor of that show? 1/100% of the entire industry. Yet that might, what you think, be your branding or marketing. And then when you do your email blasts, you're only talking to your echo chamber. You're only talking to the people that you know already. It's not wrong, but it shouldn't be the only bullet in the chamber. It's the people who don't know you that you need to reach. And how are you doing that outside of a classic analog move? Marketing. I keep on coming back to marketing. Historically, marketing has been massively disrespected. Based on the adage of 50% of my marketing spend is ineffective, I just don't know which 50%, so I'm just going to keep throwing the money at it. That's classic marketing. Marketing in the sense that we're talking about is digital storytelling on a platform, at a scale, on a regular cadence, every single day in the market that you are playing in currently and the market eventually that you want to be in. Remember, it's not what we make, it's who we are. And my marketing efforts right now, and you'll see, I didn't say marketing dollars. My marketing efforts right now are going to be marketing towards where the proverbial hockey puck is going to be 3 years from now in medtech, and where my acquisitions, integrations, and product development that come out of Freudenberg proper, that's where I should be spending 1/3 of my marketing efforts. So look, digital marketing and branding is not a sales channel. Stop looking for an ROI on it. Stop making it the first thing you cut on your budget when you've got to make your numbers, because you have not rationalized and you think of marketing as advertising, and marketing is not advertising. Marketing is educating. You are in the education business. You are not in the contract manufacturing business. You should be an educator who happens to be a supplier contract manufacturing. That should be a cultural mindset for you. And I'll leave you with this. This has served myself, and the people who adopt this well is give information, infotainment, education, without expecting anything in return, but be standing there in plain sight when they need something. And that has served us and our clients extraordinarily well. Thank you.